Dr. Dave Nelson, and we have Dr. Ahrens and Dr. Gluckman on.
So this is John Gluckman up in Vancouver. I'm a retired doctor of chiropractic, and I've communicated with Dr. Ahrens several times about his product, and tonight I just want to introduce him to all of you on the phone. He is very soft-spoken. He's very kind with his time. He'll spend as much time as we want in terms of answering some questions.
I have two questions. People have called in or text me. So, Dr. Ahrens, type 1 diabetes, and how does this affect weight loss? Two different topics, but type 1, is it effective and supportive, and also in the area of weight loss?
Well, we couldn't undertake every single study that we wanted to undertake initially, but our first animal study with type 1 rats, these were rats that had no functioning pancreas. They were type 1s. That was our first study, and we not only kept those rats alive without a functioning pancreas, but it reversed the type 1 diabetes. And it was, I was discussing that with a head of research at a major pharmaceutical company, and there's just hardly no way around it. We appear to be rejuvenating beta cells. That means that there's endogenous production of insulin after taking products such as Emulin. Now, we were thinking, okay, what are we going to do? We can go down the type 1 route. We were going to do the pharmaceutical route, and we decided that we were going to keep it a food supplement because really that's the issue. We don't need another drug. What we need is just people to get this stuff into their diets. And we were going to focus on type 2 diabetes at the time because my partner's mother had type 2 diabetes. That's really what pushed us in that direction. So then when we did our human clinical, it was a small one, but we reversed type 2 diabetes. So I can say, yes, I'm certain it helps type 1 diabetics, and I have given it to my own relatives that have type 1, but I do not have the clinical study to back that up. There are plenty of papers, though, you could just find on PubMed about endogenous insulin production and polyphenolics. So yes, for type 1, you've got nothing to lose. It's not going to hurt you. It's not going to interfere with anything. It's just that as you get better, you need to watch your intake of your medications because you become healthy. You won't need them, and you could go low blood sugar. You know, you have to monitor your blood, and if you're type 1, you're certainly monitoring your blood. I had a story of telling this one lady who was on an insulin pump, and I said, look, I am not your doctor, and any one of people listening, I'm not your medical doctor, I'm not a physician, I'm a researcher. So that's a, take care of that legal statement there. So tell everyone, if you're in that situation, you need to consult with your doctor, you need to get with them, but it absolutely works. Worked in those rats fine. As far as weight loss goes, you know, the weight loss, the way we've approached this is weight loss is kind of a side benefit because there is a direct correlation, as most people know, certainly the doctors here, a direct correlation between blood sugar levels and weight, excess weight. So you may not be pre-diabetic and you may not be diabetic, but you might have a little too much sugar in your blood, and insulin is going to look to put that into fat tissue. So we inhibit that action. We do not shut it down entirely. We think the body knows what it's doing. We just inhibit it a little bit. We get the sugar to be burnt up in muscle tissue and also into your brain. The brain only lives on glucose in most normal situations. It just thrives on glucose. So the result is you feel energized, you feel bright, and you'll start losing some pounds. Now, there's There are two Emulins out there on the market right now that you have, M and C. And the M is for people who have no concern over blood sugar levels. They're not pre-diabetic, they're not diabetic. They should take the M because that M contains more quercetin, which is very conducive for glucose to leak out of fat tissue. Quercetin causes glucose and triglycerides to leak out the process of lipolysis back into the bloodstream, and then it can be burned up in the muscles. So that's great for weight loss, but it's not too good for diabetics. So we have the C, which has less quercetin, only a trace amount, so that we won't have to contend with any elevated blood sugar levels.